Ladies and gentlemen, I welcome you to this channel. This is Dr. Hemorrhage, and I'm going to share with you something very important about health, and that is postpartum hemorrhage or PPH. And PPH, generally speaking, PPH is the leading cause of maternal morbidity and mortality worldwide, and of course it is among the preventable causes of death. PPH is divided into two: primary PPH and secondary PPH. According to the American College of Obstetricians and Gynecologists, primary PPH is defined as cumulative loss of blood of at least 1 liter or more, accompanied by hemodynamic instability that occurs within 24 hours after delivery, while secondary PPH is excessive bleeding or significant bleeding that occurs after 24 hours of delivery until 12 weeks postpartum or after delivery. There are a number of causes of PPH. Basically, there is a mnemonic of 40s. In 40s, we have one, which is the tone of the uterus. Number 2 is the tears or trauma. Number 3 is the tissues, which include the clots and membranes and placental membranes. And then number 4, of course, is the thrombocytopenia. I'm going to break down the 4 causes of PPH because this defines the basis of management of PPH. And in order to have the best management of PPH, you have to understand the 40s or the 4 causes of PPH. Among the 4 causes, let's talk about the tone. The tone refers to the tone of the uterus. Usually, for bleeding to stop after delivery, the uterus has to contract. The contractility of the uterus determines the tone. The venous sinuses that were opened during the delivery of the placenta will not close because of the low contractility or because of the atonic uterus. There are a number of things that cause the uterus to be atonic or flabby, and one is having a big baby or delivering a big baby. A big baby that is more than 4 kilograms will make the uterus to be atonic. The other one is having polyhydramnios, or having a lot of amniotic fluid, will stretch the uterus and of course reduce the contractility of the uterus. The other one is misuse of the uterine tonics, including oxytocin, misoprostol during delivery. The other one is precipitated labor. There are mothers who develop precipitated labor. These are the mothers who deliver from the onset of labor to delivery doesn't go more than 4 hours. The uterus is exposed to a lot of endogenous oxytocin that it contracts, that it overcontracts, and of course after delivery it becomes atonic. And so many other causes to mention but a few. But to trauma to the uterus, the cervix, and the perineum. Usually you find tears within the perineum of different rates. You find tears on the cervix, you find tears in the uterus, and of course this causes bleeding, and it accounts for 20% of the cause of PPH. Number 3 are the tissues. You may find that there are still retained tissues in the uterus, and maybe clots, maybe placental maybe placental tissue, maybe membranes that could still be within the uterus, and this of course causes imperfect contraction of the uterus. And once the uterus doesn't contract, of course they'll still be bleeding. The other one is thrombocytopenia. There are some conditions that cause thrombocytopenia or low platelets that can result into bleeding after delivery, and this include a placenta previa, eclampsia, or severe PET. We also have things like IUFD, or where there is fetal demise. Usually there is thrombocytopenia.